Welcome back to Hey Baby and Beyond. I'm Lauren, an antenatal and postnatal teacher here in the UK. If you're new here, don't forget to subscribe to the channel and do click the notification button so that you see the videos as they get posted. In today's video, I want to talk to you about what to expect in the very early postnatal period after having your baby. These are things that nobody tells you about, your friends don't share with you, and sometimes you're left finding out for yourself, and sometimes that is not good. So the first thing that we need to talk about is postnatally, what happens after you've had your baby. So immediately after you've had your baby, if you've had a normal vaginal birth, then you will be asked to get up and go for a shower, a little wash down, and maybe that first wee. We like you to do that first wee within the first 3 hours after having either a vaginal birth, or if you've had a catheter removed, within 3 hours after the removal of the catheter. Your wee is going to be measured in a bedpan, and this is to make sure that the fluid and the urine is coming out the way it should, and that you're feeling that sensation of having a wee. So after the first wee is done and it's ticked off that you've had a big enough void, the next thing after that, if you go to the toilet, you can wee in however you want, whatever position, whether you want to do it stood up, whatever that is. Some people do use a peri bottle, which is a bottle with a spout on it, which you can then use to pour water in that area, which keeps it clean and can sometimes help things not feel as stingy. One good tip to do is to drink lots of water post-birth. Obviously, we expect women to stay hydrated during labour because that's a good thing. But post-birth, make sure that you're drinking the fluids to help dilute your urine to make sure it's not as stingy. Another thing to think about is after you've done that first wee, if you do want to, then you can use something to pour water down there. If you don't want to buy the peri bottle, you can use a small jug or just a cup of water just to pour down below when you're doing that first wee. The next thing to think about is that the postnatal period will always bring postnatal bleeding. The first blood loss that you will get as a postnatal person is lochia. That is the first postnatal bleeding that mums do see, or birthing people do see. This is the remaining parts of things that need to come out, and everybody's postnatal bleeding will be slightly different. But what you do need to remember is that you're using maternity sanitary products and not just nighttime extra absorbent products. The idea is that with sanitary products that are designed for maternity, they are designed differently. They have different coatings on them. They're made so that they don't stick to any stitches that you've had down below. So they do need to be maternity products that you're going to use in that postnatal period. Every woman or birthing person will bleed postnatally. For some women or people, it might just be for a couple of days or anything up to 6 weeks. So this is just something that we can expect, that we need to keep an eye on. Any clots bigger than a 50p piece, then you need to speak to a healthcare professional, but just keep an eye on your blood loss. And if you notice that things become heavier, then maybe you're just doing slightly too much and you need to take it down a pace. The next thing to think about is that all birthing people's breasts will leak after birth. I would give you the advice to invest in a really good pair of maternity breast pads, for reusable ones. So the idea is the reusable ones are a lot more gentle on your skin, they're a lot more comfortable to wear long term. So in the first stage you might want to wear some disposable breast pads and then move on then to a pair of really good reusable breast pads. You normally get 2 sets in a box, and you can then go on to wash them in between a wear and have one that's clean and dry. The next thing to think about is the postnatal period for most people who've given birth is a very emotional time. So we know that baby blues peak around days 3 to 10, but if anything is lasting longer than the 10 days, we do need to be speaking to a healthcare professional, seeking that help postnatally and making sure that we are getting some support with these postnatal feelings. It can be anything from the birth experience that's triggered it to anything kind of that's happened in the part after birth, but it's a hormonal change. So for some people, they do go through this and they do need a little bit of support, and that's okay. But it's just really important that you're getting that support straight away. Keep a diary, keep a note of how you're feeling postnatally, and it's a lot easier then to share that with a healthcare professional when you see them for that support. The next thing to think about is our diet after birth. So no, you don't have to eat beans, but what we're trying to kind of encourage is that you're keeping a healthy diet, lots of fruit, lots of fibre and lots of water, because if we don't eat our fibre, we're going to become constipated, and that post-birth poo can sometimes be what gives people fear after birth. This is not something to worry about. We're not expected to do this immediately after birth now. So we're just making sure that our bowels are opening at some point, and that can be in the postnatal period once you've gone home. Obviously, by keeping your fluid intake up, eating fruit and veg, we're hoping that that fibre helps and stops you from getting constipated. Constipation is really quite common after birth, and if you are experiencing this, do make sure that you get some advice from a pharmacist and get some stool softeners to take. We don't advise to take laxatives, but definitely something to soften it to help you do that first postnatal poo after birth. If we start straining after birth, and it can also be quite common after we've done a lot of pushing, but piles after pregnancy, during pregnancy and after birth are really quite common. Do not sit and suffer. Do make sure that you're reaching out and getting some support for them, because it can be really painful when you're already trying to recover from a birth on top of you don't need this going on as well. The next thing to think about is that postnatally, it'd be great if we could say to rest, and everyone should rest after birth, but actually what happens is in the hospital setting or immediately after birth, your adrenaline is causing you to be awake, to look after your baby and to stay alert. And that's because the primal side of birth would be so that nobody comes and takes your baby. So what often happens is when you get home, that's the point when you might find that you decide that at that point you're going to sit and rest, and you can completely relax because you've got somebody there who you trust with the baby. So do just start to make sure that you are resting, even if it's not sleeping. On that note, it's quite useful to think about setting some boundaries for after birth. So do you want to be bombarded with visitors straight away, or do you want to give yourselves a couple of days or a few hours to get settled in as a family before you go on to invite people into your home? These are conversations that are really good to have in that antenatal period while you're in a clear mindset, you're not tired, and you're managing to have a really good conversation about these things. The other thing that we need to talk about is our pelvic floor exercises. So the NHS do the Squeezy app. We've got to remember that the pelvic floor is like a hammock, and during pregnancy this hammock is stretched and stretched and stretched, and if we don't do those pelvic floor exercises, then we're going to have a lot of strain on our pelvic floor, which can cause things like incontinence, and that's not okay. So if you are struggling with that, do make sure that you see the GP. The health visitor can signpost you, and make sure that you are being really aware of your pelvic floor exercises and making sure that you are doing them. The last few things just to touch on postnatally are that returning to a normal sex life after birth is quite common, that it's not straight away. It can be anything from when that postnatal bleeding ends up until evidently around 13 to 14 weeks postpartum. There's no right and wrong time to do this, but again, it's about being really open and honest with your partner and making sure that you make a bit of a pact to say, yeah, I'll tell you when I feel fine, and that's when we'll try things. Healthcare professionals will ask you whether you have tried, and it's purely just to know whether everything felt okay or there was any pain or bleeding after you've done that postnatally. So again, if there is, you stop and you wait and you see a GP or your practice nurse in between. So contraception, we need to use contraception if you're going to have sex post-birth, because you are fertile around 3 weeks after having your baby. So if you want a close age gap, then that's absolutely fine, but if not, do make sure that you are using protection, and you will be asked about contraceptives, so i.e. the pill injection, at your postnatal checkup, which is 6 to 8 weeks. So there's lots of things going on in that postnatal period that we do need to be really aware of. It's a very vulnerable time for lots of people. It's changes to your body, it's changes to life, the world, you're getting used to your new baby, changes in your relationship. So it's just really important that you do look after yourself, and you do make sure that you acknowledge that recovery after birth can take time, different amounts of time for each person, but do be kind to yourself and do give yourselves time to recover, both physically, emotionally and mentally. I hope this video did help you get prepared for the postnatal period, the bit that people don't talk about. If it did, do drop a comment below or hit the like button, but make sure that you do subscribe to the channel for lots more content for pregnancy, for labour, for birth and for beyond.